looks like I've got great lighting, but I haven't. It might have dimmed then. I've got a USB fish tank light on a small tank, and it makes the lighting look really good. Hey, who needs all this expensive lighting to have your YouTube channel going? So, I've done a quick live, let a few people come along. I think that my normal subscribers, I don't mean that in any bad way, they seem to be coming on during the day and afternoon. I see them in the comments. When I come on at night time, I don't really see them. So not normal, I'll say as old subscribers. That makes more sense. We have gained another two over my last live. We're currently sat on 252 subscribers, which is, it's not a bad number, but it'd be nice if we could get it up a little bit. We try to hit the 300 marker, it'd be nice. But if we don't, it doesn't matter anyway, because the whole purpose is just to speak bronchiectasis anyway. Alright, Nocturne, I was just thinking about you, mate. I just said then, it's been a while since I've seen the old people. I said normal people at first, but none of us are normal, so I meant the old subscribers come along, so it's nice to see you. Nice. So yeah, it's just an update really. I'm on day 3 now of my IVs. I told people in the last one that they changed the medication. So just to recap anyone or people who are not aware, I've been on meropenem for about 5 years now, on and off the cycles. So that means every 3 to 4 months I was having it 2 weeks at a time. And I was going to bring it up in topic with a specialist last time I was in, but because we've got so much going on with this battle between microbiology and all this nonsense, it totally slipped my mind to say that I actually think that it's taking a while for that drug to get me feeling well. And what I mean by that is, it would normally take me 1 to 4 days to feel like the antibiotics were working, but then it was almost like 7 to 10 days before I felt the meropenem working. So the reason being, my specialist has switched over from meropenem to caftazidine is because they're worried about resistance in antibiotic. Now, it only dawned on me yesterday when I was thinking, I should have brought that up in my specialist appointments, that I don't think that the meropenem that I was on was doing the job it used to. But because we've had so much nonsense going on back and forth with this new system that's trying to, stop people's treatment, who, if they don't get the treatment, they'll die. We've been focusing on that. It slipped my mind to tell him. So yeah, this new medication I'm on, I think it's working. I've not had when I say no side effects, I mean very limited. Obviously you can see a bit round here, like I'm getting redness and dry skin. I get a lot of that anyway when I'm on the IVs. I've not really had a bad stomach or anything that you would associate with antibiotics. And the one thing I will tell you is the side effects. I'm very hungry. I've noticed with this one, it seems to give you a bit of an appetite, and that's about it. So I don't want to jinx it yet. Day 3, we're feeling okay. Let's say, I had a moment before when I started dipping a bit, where I started feeling a bit achy, and that fluey kind of things with a chest infection, and a little bit like I'm sweating the medication out of the infection. So it's all positive signs. Hi Kate, are you okay? But yeah, so what's happened is now my treatment is just once a day, opposed to twice a day, and I'm at 4 grams of ceftazidime. So I think what they'll do, if this works, they'll probably keep me on this for a year. And then once I start complaining, saying, listen, it's taking me longer to get well, I reckon they'll up it to twice a day. But at the moment, the way things are going and my living arrangements, it suits me more to have it once a day anyway. So everyone just pray for me that we can have it for a year this way, and it'd be very, 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 very nice. So what's everybody doing? Sorry, Nocturne, I'll read now, mate. I was just blabbering on. Sorry I haven't been around. New job has been keeping me busy. At least something's been keeping you busy, mate. You have to have something to keep you busy or you'll crack up. Right there, AG Blue. So, yeah, apart from day 1, I got a bit of a... I've met this person before. So on day 1 of treatment, you get like risk assessed and just make sure everything's the same or if anything's changed. So much like an admission in hospital, even though you're under the urgent response team, every time it comes along, they still have to do risk assessments like you've been admitted in hospital, so to speak. So this one particular person, I met her a few times and she seemed lovely, lovely person. And then she was on her own and she was on this massive power trip, asking me really intrusive questions, asking me to go and do things. Well, I point blank refused them. And I'm not going to go into detail, obviously, but it felt very, very intrusive to the point where I was going to put a complaint in. So there's two ways around it, really. There's either putting a complaint in or just doing your own thing, and when they ask you silly ass questions, you just reply to it, nothing's changed. Nothing's changed. Everything's the same. Go on about your day. You're only here to give me my medication and leave. But some of them do annoy you, but that's all aspects of life. Hi mate, long time, hope you're doing well. Alright, Abdul Rashad. It's been a while, crocodile. In a while, crocodile. But yeah, I'm just on a new medication, mate. And I will say, what happened, they wasn't very happy about. So, on day one, you sort of get your... I can't get this t-shirt off. Let me see if I can get well jumper off. Let me see. Right. So, on day one, you get risk assessed. And then you go through your medications and things like that. And then you'll have your needle, if you've got a port, you'll get that put in, right? And then what they'll do, they'll withdraw blood from your line. Now this person, I didn't even realise, guys, because she was doing my head in that much. I just wanted her to go. Well, see this cap here? This bit wasn't on. So I'm going to show you. That bit wasn't on. And I didn't know that's a lifesaver. All that was on was that green cap on there. Now when this other nurse come, she said, you're very, very lucky. I said, why? I said, because this port will not bleed back unless pressure is applied. So what I mean by pressure is they would put a syringe in here, no needle, just a syringe, and then they pull back and that's pressure applied. But then she said all you would have had to do was cough, you know, a bit, and pressure's applied and blood would come down the line. So I could have bleeded out throughout the night because that cap there, even though it's safe, it's tight, it's not as airtight as this valve. Once that valve's on there, nothing can get in. So it was, you know, it was a pretty scary moment because I had a similar situation with a cannula once, and I wasn't even moving. I had the cannula in a situation round here, and I wouldn't do nothing. I wasn't on my phone, wasn't messing about it, and the cap just push, it come off itself, and then I was gushing out blood. So all I knew to do was, obviously, like if you had to cut, you put pressure to stop the blood flow. So that's all I did. I got my finger over the bit that's popped out, stop the blood coming out. We found the actual bit, put that on, and then shortly a nurse come back and changed the set because the set must have been faulty. So it's very, 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 very dangerous. You know, you don't realise this is a great treatment, having all this, but you know, if a nurse incorrectly does something wrong, could cost you your life. Another bronchiectasis, asthma, COPD. Yeah, that's right, Adria. Is it Andrea? Sorry, Andrea, yeah. Got it, you know, beneath the surface. I'm sick of people who think, you know, just because you look well, than the average poorly person, that everything's good on the inside as well. That's the reason we have specialists. That's the reason why we're scientifically backed up by, you know, infection after infection and sample after sample. And I didn't know nurses were, you know, specialists. I didn't know the nurses were maybe specialists in administrating antibiotics. But when they come at you from a standpoint of, like, they know about antibiotic resistance, they know about the risks versus the the cons, the pros and cons, you feel like telling them shut up. And that's not me being rude. That's me knowing my own body and stop giving me premeditated garbage. Without antibiotics, we are going to crumble. That's why we're on them every 3 to 4 months. It's almost like saying, you know, you see these videos of people in Africa and the babies are very poorly, and just for £2.99 this tablet would stop this baby dying of pneumonia. Are you going to go over to Africa and say, listen, don't give that baby that tablet there because you might get antibiotic resistance? No, you wouldn't, would you? So the same term could be applied for people like myself. You know, it's just garbage when you hear that nonsense. You know, especially when you've battled it all your life and you just think, do you know when you've heard the same song on replay, the same regurgitated garbage, and I don't know. Are you from Turkey, mate? All right, matey. So, Andrea, yeah, it's just this life. Life is what you make it, really. I know it's all about demand. I know the demand's massive. Lung diseases, you know, it's not just people who smoke anymore. It used to be all about smokers, and now they're finding out that a lot of health-related lung problems isn't by smoking. You know, some people are born with it, you know, cystic fibrosis in particular. I've also said that bronchiectasis are very similar. So yeah, currently on cotrimoxazole. I can't say trimoxazole. I can't remember. I think I've been on that one. Not too sure about that one. And some samalol nebs, sabutamol nebs. I think that is. Yeah, I'm on. What do you call it? I'm on. I forgot the name. You know. I keep thinking it's clarithromycin. I was going to go and get it, but I've got one here. I haven't got one here, but if you look back on my other videos, you'll see that I'm on a nebulised antibiotic daily as well. So, you know, mine was undiagnosed chickenpox pneumonia. I've never heard that, Andrea. I'll have to look at that up. But yeah, when I say didn't feel too bad going into this treatment, I felt more like I had a flu or a cold. But as soon as I got the antibiotics within 2 days, I thought, if this was a flu or a cold, I wouldn't be picking up now through antibiotics. I don't know what my blood results said. I had a sputum sample to send. She didn't take it. You know, she's asking me all this and that, yet she said, oh, don't request a sample. Yet that's what they've been mithering for. Make sure the bronchiectasis patient takes the sample, does a sample. So yeah, and they do it again. Colimycin. No, it's similar to colimycin though. Gentamicin. It's called gentamicin. Yeah, I used to be on tobramycin, and the tobramycin is in particular meant for cystic fibrosis patients, and I was one of the first, as far as I know, I was one of the first bronchiectasis patients to have it prescribed. That's how bad my chest condition was, you know, very, very severe on the lines of infections, you know. And it made me wheeze. Colimycin made you wheeze. You know what it did to me? I remember it now. It gave me a really bad throat. A very, very, really bad throat pain. Almost, you know, like when you've got tonsillitis, like that. And I did everything that they told me. The oral hygiene, gargle water, you know, warm water, salt water. It didn't work. So they were thinking about not prescribing me the gentamicin because I might have the same side effects. Now, just because antibiotics are in the same family name doesn't mean you're going to get the same side effects, because there might be something in this tablet that isn't in that other tablet. And this is what I tried explaining to people, but I guess they don't get it. But I'm a prime example of that, because colimycin didn't agree with me, gentamicin did. A azithromycin tablet didn't agree with me, but gentamicin did, and any other mycin. Clarithromycin, I don't really like. There's a reason behind it. When I had a bad pneumonia once, and they prescribed it me, and then they started giving it me as my rescue pack, clarithromycin, and I don't know if you have the same problem, but it's almost like you get this bad aftertaste of the tablet, but along with the infection. So you're getting the taste of the infection and the clarithromycin, and it's absolutely disgusting. So unless that's the only treatment to save my life, then that's the only time I'm taking it. I'm strong. I'd have to be a little bit strong. I've not been wiped out. I'm nearly 39 this year, and you know, some of the battles that I've had, you know, oxygen, maximum oxygen during COVID, CPAP machine, being moved from one ward to the next ward with a resuscitate bag, a backpack, oxygen tank, and then actually making it out of there alive. You know, I got told that my chest wouldn't be strong enough at this point to ventilate, so the only option I've got is this CPAP machine. And you know, but I don't say I'm strong. Obviously, I say it's all about who I believe in, and that's Jesus Christ. I won't be here now without him. Let me tell you that, because one of the doctors come in and said, if you wasn't, you know, if it wasn't for you being strong and young, then you wouldn't have made it. But I don't think people are as strong as they think they are. I just think sometimes your time's your time, and sometimes your time's not your time, if that makes sense. Tachycardia, yeah, I get tachycardia. I've not been too bad at the moment. These watches are really good. I bought this one, it's slightly faulted, but some of them actually give you an oxygen saturation, heart rate, and this one actually gives you a stress test as well, so you can monitor your stress. What was happening with me when my infections were really bad before I was on IV medication, this is how silly it was getting. You've got, I think it's your jugular ear, or your jugular ear, not, yeah, your jugular ear, I'm getting confused, your windpipe. So you've got a windpipe where you can press in. My tachycardia was that bad, you could see it pulsating like this. And yeah, it still does it from time to time. I still have a quite high heart rate, not massively, but I'm going getting some tests done in June just to see what's going on there. So yeah, it is what it is. Oh my God, you've had it bad. Yeah, isolated with it all through COVID. Well, I didn't believe. I shouldn't say too much on this because you don't want him to, you know, stop the video going out. But I didn't believe in it, and I want to say don't believe in it, as in it wasn't as bad as people were making out. I didn't have it for 2 years, and this and that, and I still do believe it was just seasonal flu. I believe it was seasonal flu and giving a certain name to roll out certain things. Let's just keep it there. And yeah, they were about to discharge me a week. I was a week in it, in the I wasn't even in the chest ward. I got put in the Ladywell ward, which is for people with Alzheimer's and things like that. And it was getting to about day 7, and I was getting fed up. And prior to this, a doctor come to see me, and he said, with people like you in the first week, we don't see much deterioration. We just see them, you know, at like a baseline, not feeling well. It's the second week that they drop, and he wasn't lying. I remember it to this day. So they were getting ready to discharge me, and I was in what they called. It's basically your own room. You know, you're not in a ward. You're in like a side room. So I was sat on my bed, and you've got a bathroom in this side room. So I go to the bathroom and back, and I'm speaking to someone on the phone, and they turned around and said, "You sound very, very breathless." And I could feel it. Something didn't feel right. It was so, okay. Anyway, and then they just dropped from there. I was hooked up to the oxygen. I was hooked up to 24-hour monitoring. I was that bad. Yeah, it was absolutely a nightmare. I was that bad. I had to eat my cereal like this, so I had a mask on, like that, and that's how bad it is. I went like that. I must have lost about 3 stone. They were getting concerned because I wasn't eating, and this was my diet. Right, my dad, bless me dad, he was coming and he was dropping watermelon off. I'll say, I don't care what anyone says, that I think that played a massive role in me making it out there as well. I'm on about the red watermelon, that's all I was eating when I could eat. Yeah. Well, you had to do so many things. I wasn't allowed to lie on my back. I had to make sure I went on my stomach a bit, pillows raised, and this was just to keep the airways open and try and breathe through it. And bloody struggle. I'll be honest with you, I didn't think I was going to make it out there. The way, you know, this doctor came in and he's holding my hand. I've been in the hospital many times. No doctor's ever hold my hand unless he's taking a blood test. So he turns around, he says, you know you're not a very well person, don't you? I said, yeah, I can gather that. He said, do you want me to make you a few phone calls? So I thought, what do you mean by that? He didn't tell me too much. So I said, yeah, phone me mum. I don't know if he said phone me partner or whoever it was at the time. So he made the phone calls. Now, I didn't know what got said. I didn't know what got said at this point. You weren't allowed visitors and things like that. So nice one there, Birmingham, nice. Hiya, okay, yeah. So you weren't allowed visitors, and the next minute there was loads of machinery coming in. They were actually taking X-rays of me while I was in the bed. I thought, what's going on here? So yeah. So then when I get home, a few weeks later, my mum told me the doctor rang, said to me, mother, you know, he's not very well. He's got a 50-50 chance. They didn't even tell me that. They didn't even tell me that at the time. So he's got a 50-50 chance if he makes it or not. So, and I believe it was a lot worse than 50-50. I've never been that bad in my life. I've even had a bad pneumonia once when I was really poorly. But you know your own body, don't you? You know when you think, right, I know we all complain and go, I feel like I'm dying. And, you know, we've said that if we've had an hangover or if we've been poorly. But this time I thought, I'll tell you the truth, I did a lot of praying. I did a lot of praying. I did a lot of thinking. I was thinking more so, you know, more about my children more than me, because I've sort of lived my life, you know what I mean? I'm still young, but I've lived my life. Yeah, I was very ill with pneumonia and bronchitis on top. But this weather's been very weird, hasn't it? It was a short and t-shirt day about 4 days ago, and then the next 2-3 days that followed it, I think this is what made me feel worse. Just the change in the weather and the climate. Yeah. So is there anything else anyone wants to say before I go? But yeah, anyone with a lung condition, really think about getting a smartwatch. Even if you don't do steps, even if you don't exercise, it could be a lifesaver, you know. Or get one of them oxygen sats. The only thing with the oxygen sats, I think you can be very paranoid with them. Like a diabetes person, someone who's got diabetes, I can't say it, yeah, taking the blood sugars every 5 minutes. I think the best thing is use a smartwatch, and if you feel like you're not too well, check it, because that's a lifesaver. If you know what your saturation should be, 99 oxygen on a good day, and it's going to 94, 93, heart rate's all over the place, you should be presenting to A&E. On that note, I'm gonna go, guys. I'm gonna go and watch something. I normally watch myself back, because I just like to know what I've talked about. Is there anything that I missed off? Is there anything I could have added on the next one? But yeah, guys, day 4 tomorrow, and 10 days after that, and then we're finito. Ciao adesso from Bronchiectus Moscow. Ciao. As see the same, pet. I'm joking.